like this open access very much. It's really great.
Well,
I think that EQuiP and Wonka could take this and they could kick it up a notch.
But also
so that all the links,
but also the individual GP,
yeah.
you can say, oh, let's check me out and let me be familiar in the evening, looking through the sites, so there's no pressure.
Yeah, absolutely.
There's been research on self-evaluation, and it just doesn't happen. It's like going to the links, so doctors just don't, I always say they don't sit near the fire stove and do something nice like self-evaluation. It just doesn't happen. So it has to be with group or with the practice or with some sort of a institutionalized incentive to do it. And but
on the other hand, I think accreditation systems like EPA always have the smell that someone is mystic persons come in and checking out and making some money with that. And we have to do this, and there's a pressure outside.
That you have
and this is a counter position that say, this is really bottom up. I will look it up and make me familiar with it. Make me familiar with that, and then I can decide EPA can come in and will discuss them.
So I think the challenge is that we need some direct positive feedback for the practice. That means not after 1 month, not after 2 months, but 1 or 2 days after that they feel that's in the right direction, because in the beginning they have to reorganize their week, no patients, no that. It's a lot of effort. And then they receive all feedback, what's not good.
Mm-hmm.
So that's not a process you want to go through. The next step, because they have confronted with 2 negative things, reorganizing your practice, the pressure of the patient, and then a feedback where you're nervous on it. And then I think, now there has to be a step that you feel it's good. Mm-hmm. It's good for me. And I think that's a challenge.
Yeah.
To perform a procedure where the target doctor is feeling very, very soon that's the good thing.
Perhaps this is the first step.
How about this idea of the virtual conferences? So we invite family doctors to sign up for webinars. So instead of you having your circle that is your local circle that you physically go to, you do it electronically. You link up, you speak with a facilitator, you talk to each other about what's working and what's not working. You can then have some kind of live questions and answers before and afterwards that you manage it. And you can actually do an assessment, a self-assessment and a review assessment with the group.
That's absolutely huge.
Yeah.
That you could do when you play with somebody in New Zealand, so it works. You have to get to play. Okay.
Good trip. Bye.
Okay.
For example, the assessment in a format of a serious game, for example, like it's used in e-learning, so that doing the assessment, the procedure itself is fun, but not the result. It's confronting, but when you do it, it's fun.
Yeah.
And then you have some positive attitude. That's what I learned about e-learning, that you have to look for all things that are fun. You start with fun.
Yeah.
And then afterwards, you go to the student and you say, that are your points, this is feedback, and so. But doing things has to be fun. And it was changed my mind. So we do not start with how to assess. No, start with what's fun for the target group. And then we start to get there. But here it's not so easy for me to see what we can offer the doctor, the practice, immediately a positive feeling about doing that procedure.
But you do that with Aqua now or not? You get immediate feedback.
I think we are going in a good direction, but looking to my colleagues in the field, then there's a whole way to go to make it fun, things like that. So, chatting with patients, doing consultations, yes, it's fun for a doctor.
But if it's fun, we don't change it. So that was always my hesitation. And if you give feedback on a Gauss curve, necessarily 50% is below average, which they don't like. And with the original FIP instrument, we had so many scales, over 50 scales, that you always had a few scales that you were above average and a few below average, so that more or less middled it. But it is a difficult message, I tell you.
Yes, yes. Did you confront or compare improvement?
Yes, we did.
So that you do not give the diagnostic tool of this is your level, but this is your improvement of past year, because that's another message than go below or above there.
Well, one of the things we did in our phase 7, we did our academic units. We went through the quality assessment in a voluntary way. We have 2 academic units at McMaster University. We have about 40 family doctors working in those units, about 90 residents in training, and more than 100 staff and other healthcare providers. So two very, very big units that we have. We put them through the process. And one of the key issues that they were so proud of was that they established 69 improvement cycles, and they completed 52 of their 69 improvement cycles. And they got really excited about improving. The meetings were fun, the successes were fun. So it wasn't about meeting their indicators.
Internal competition?
It was, I think, the innovation of designing changes which weren't limited to one lead. So you didn't say, okay, we could only do 4 changes because we have 4 leaders, and they only have time for one thing at a time. They took on 3, 4, 5 things themselves, each of them, things that they were passionate about and that they wanted to improve. They identified them and gave themselves
identified it on the basis of this instrument.
Yeah, and gave themselves a task. Now, some of the areas that they identified were pre-criteria. They're not ready to deal with the criteria. They're things that they had to put in place before the criteria. They're just as important as the criteria. And they took a lot of work to do. So they gave themselves credit for everything that they were doing that was bringing about change, and felt as if they were in charge of their destinies. And they now have quality breakfasts on a regular basis, and they talk about not each individual thing that they're doing, although some of them are big breakthroughs for them and they're very excited by it, but much more the general positive, appreciative inquiry type of approach to what they do.
Progression?
Yeah, the progression that they're making.
Well, like the fitness people.
Yeah, exactly.
The outcomes of this assessment, is it in the report?
Yes, so if you look at the website, it's on the website. So our website is very much focused on the phases of our project, and each report is a report of each phase. And phase 3 has been published.
No, not about, no, I think for the individual practice.
Oh.
The practice report.
Is it a practice report?
Yes, it's a practice. We have an online tool. We haven't developed the online tool yet for this, but we have an online tool for our original tool, and each of the indicators are in there. And then the master assessors have a copy of the tool in hard copy. Most of them didn't do it on the web. I did it on the web. And the practices themselves completed on the web, and they complete the written material that they send in, and they put it together as a report. So they have some appendices like the practice brochure or the descriptions of their job descriptions or something like that, which they attach as appendices, and then they complete the grid of how they're doing on each of the different criteria. And we've managed to streamline it, not nearly as well as Australia. Australia do it like in an hour. They go in there and they complete it in that time. But ours was more an experiential thing. We enjoyed the experience of discussing all the things. We weren't pushed to do 100 in a year to know how many.
Well, it's interesting that you have the complete assessment thing like Australia, and you have more discussion. Glenn Allen, he did the maturity matrix. You know the maturity matrix?
Yeah.
In fact, you could do this with the maturity. You could, as a team, score. Each of one scores, and then you see the differences. For example, on timeliness, if the assistant says, well, we're very low, and the doctor says, well, we're doing pretty well, you can discuss the differences in the team, and then decide, well, we differ, let's measure it, or let's improve on it, or it's not an issue. And that's
we
sort of
actually
maturity.
did that in a qualitative way. So we had their self-assessment, which we had long discussions about whether we should even look at their self-assessment or whether we should be objective. We look at their self-assessment, we look at our
The
assessment.
self-assessment of the team or the self-assessment of the doctor?
The self-assessment of the team,
That's
which the doctor
good.
generally
Of
wrote.
course, okay.
And then we look at the assessment of the assessor, and they sometimes differed, and we had discussions about why you thought that. In fact, a lot of
That's
the
a bit
assessment
mature
process was
thing,
around that.
Okay.
Okay. Well, thank you
Thank you very much. Very interesting. Very good. Fantastic work.